know, getting older has its perks: senior discounts, a lifetime of stories, and hopefully some grandkids who don't just call when they need money. But let's be honest, the body's check engine light seems to come on a lot more often. And while some aches and pains are part of the package, there are a few warning signs that shouldn't be ignored. Think of these as your body's way of saying, hey, don't tough this one out. Our health becomes a little more like a high-maintenance houseplant as we age. You don't need to run to the doctor every time you sneeze, but a few symptoms need your attention before they turn into something serious. Today, we'll walk through 4 crucial signals that older adults should look out for. And to make things interesting, I'll give you some real-life examples of people who ignored, or thankfully, listened to these signs. Welcome to the Elder's Compass. If you're searching for a place that truly understands and supports life's later years with practical wisdom, encouragement, and helpful tips just for you, you're in the right place. If you're ready to face this stage of life with resilience and grace, go ahead and subscribe to our channel. Let the Elder's Compass be your steady guide on this journey. Hit that subscribe button and join our community today. Now let's begin. 1. Difficulty breathing or shortness of breath can be a worrying symptom, especially as we get older. While it's easy to brush off as just getting old or the result of overexertion, breathlessness can actually be a warning sign of some serious health conditions. If you find yourself struggling to catch your breath during light activities, or if you're experiencing sudden or severe shortness of breath, it's time to take it seriously and get checked by a doctor. Sure, shortness of breath can sometimes be explained by relatively harmless factors like anxiety or physical exertion. But if it's frequent, unexpected, or becoming part of everyday life, it could point to larger health issues. For instance, heart failure, chronic obstructive pulmonary disease, COPD, and respiratory infections like pneumonia can all show up as difficulty breathing. Addressing these issues early is crucial because if left untreated, they can quickly worsen and lead to severe complications. In some cases, sudden shortness of breath might even be a sign of a pulmonary embolism, which is a blood clot in the lungs and requires emergency care. So what exactly is happening in the body when we experience shortness of breath? Essentially, when the heart or lungs aren't functioning well, they struggle to deliver enough oxygen to the body's tissues. This creates a hungry feeling in the lungs, a sensation that your body isn't getting the oxygen it needs. Over time, this lack of oxygen places stress on other organs, which can cause fatigue and make simple daily activities feel exhausting. Recognizing when shortness of breath isn't normal is key to catching issues early. Here are a few patterns to watch for. First, if you find yourself struggling to breathe while you're just sitting or lying down, that's a sign something might be wrong. Second, if you feel like you're working harder to breathe, even when you're not exerting yourself, pay attention. Third, wheezing or a wet breath sound, which can indicate fluid buildup in the lungs, is often associated with heart failure or severe lung infections. Finally, if simple activities like showering, getting dressed, or even talking start making you feel winded, don't brush it off. It's better to be cautious and get it checked out. Take Mr. Thompson's story, which might sound familiar to some. Mr. Thompson, a 76-year-old retired school teacher, always enjoyed his peaceful evening walks around the neighborhood. Walking was his way to unwind and stay active. But one evening, he noticed that he had to stop midway through his usual route to catch his breath. He shrugged it off, thinking it was simply age catching up with him. However, over the next week, his symptoms didn't improve. In fact, they got worse. Even climbing a few steps left him winded, and bending down to tie his shoes felt like a struggle. Mr. Thompson's daughter, worried about his sudden shortness of breath, convinced him to go to the doctor. At the checkup, the doctor performed a few tests, including an electrocardiogram, ECG, and a chest X-ray, and discovered that Mr. Thompson was in the early stages of heart failure. The doctor explained that his heart wasn't pumping blood as efficiently as it should, which meant that his muscles and organs weren't getting enough oxygen. This explained why he was feeling short of breath during simple tasks. Luckily, because they caught the problem early, Mr. Thompson was able to start a treatment plan, including medication and some lifestyle adjustments like a low-sodium diet and a light exercise routine. These changes helped stabilize his heart condition and allowed him to continue his beloved walks, albeit at a slower pace. Mr. Thompson's experience highlights the importance of recognizing and addressing breathing issues early before they progress into something more serious. If you're experiencing shortness of breath, here are some practical steps you can take to manage it while you seek medical advice. First, monitor changes in your breathing patterns. Take note of when you experience shortness of breath and what triggers it. Does it happen after meals? When you're lying down? Keeping track of these patterns can help your doctor diagnose the cause more accurately. Second, stay hydrated. Dehydration can thicken mucus and make breathing harder, especially for those with COPD or asthma, so drink plenty of fluids, but avoid caffeine and sugary drinks. Third, if you find yourself feeling short of breath at night, try sleeping with an extra pillow to elevate your head. This can reduce pressure on the lungs and make breathing easier. Finally, practice pursed lip breathing. If you're feeling winded, try inhaling slowly through your nose, then exhaling gently through pursed lips, as if you're blowing out a candle. This technique can reduce anxiety and improve oxygen flow. While shortness of breath can sometimes be managed at home, there are situations where you should seek immediate medical help. If you experience sudden and severe shortness of breath along with chest pain, bluish lips, or an inability to speak in full sentences, head to the emergency room immediately. These symptoms could be signs of a heart attack, pulmonary embolism, or a severe asthma attack, all of which require urgent care. In the end, shortness of breath is often your body's way of signaling that it's working harder than it should have to. By paying attention to these signals and seeking medical advice when needed, you can keep minor issues from turning into major health concerns. Remember, you've got plenty of life to live, and there's no need to let shortness of breath get in the way. 2. Chest pain is one of those symptoms that nobody wants to experience, and for good reason. It's a warning light that shouldn't be ignored, especially for older adults. While there are many potential causes of chest pain, some of them are serious and require immediate attention. Chest pain can be anything from a mild, nagging discomfort to intense pressure that feels like something heavy is sitting on your chest. No matter how mild or severe the sensation, chest pain is never something to brush off, especially if it's accompanied by other symptoms like nausea, sweating, or a feeling that the pain is spreading to other parts of the body. For older adults, chest pain might indicate a range of issues, including heart attack, angina, reduced blood flow to the heart, or even a pulmonary embolism, a blood clot in the lungs. While younger people might be tempted to wait and see if the pain goes away, older adults need to take immediate action. Why? Because the heart and circulatory system naturally weaken with age, making older adults more vulnerable to heart-related complications. When in doubt, it's better to err on the side of caution and get checked out. Here's a breakdown of what might be going on in the body during chest pain. For conditions like a heart attack, a blockage in one of the coronary arteries restricts blood flow to a part of the heart muscle. Without sufficient blood flow, the affected area begins to starve for oxygen, causing the chest pain that people typically describe as tightness or pressure. Angina, on the other hand, is similar but is usually triggered by physical exertion or stress and generally eases with rest. Pulmonary embolism, a condition caused by a blood clot lodged in the lungs, can create sharp chest pain, especially when taking a deep breath. Each of these conditions has a unique cause and treatment, but they share a common urgency for medical intervention. A general rule of thumb for chest pain is this: if you experience any discomfort in your chest that lasts more than a few minutes, or if it comes and goes unpredictably, seek medical help immediately. Time is crucial, and early treatment can prevent further damage. Now let me tell you about my neighbor, Mrs. Garcia, a story that might hit close to home for some of you. Mrs. Garcia, a lively 73-year-old grandmother, was preparing her famous enchiladas one evening when she suddenly felt a dull ache in her chest. She dismissed it, thinking it was probably indigestion from a larger-than-usual lunch. She took a moment to sit down, assuming it would pass. However, the ache didn't go away. In fact, it started to spread down her left arm. As she sat there, she began to feel slightly nauseous and noticed a wave of dizziness. Fortunately, her son was visiting, and when he saw her pale and uneasy, he immediately recognized the signs of a potential heart issue. Without hesitation, he insisted on taking her to the hospital. At the ER emergency room, doctors ran an ECG, electrocardiogram, and other tests which confirmed that Mrs. Garcia was in the early stages of a heart attack. Her quick response, thanks to her son's vigilance, allowed doctors to act immediately. They performed a minimally invasive procedure to open up a blocked artery, restoring blood flow and preventing further heart damage. Without her son's insistence on getting medical help, Mrs. Garcia's heart attack could have been far more severe. After her treatment, her doctor recommended a few lifestyle changes, including adjustments to her diet and a light exercise routine to help reduce her risk of future episodes. Her quick trip to the hospital had, quite literally, saved her life. Recognizing the symptoms of chest pain and acting quickly can be life-saving. Many people describe chest pain as a feeling of pressure, fullness, or tightness, like a heavy weight on their chest. This type of discomfort is often a warning sign of heart issues, especially if it's persistent. If the pain radiates to other areas, such as the left arm, neck, jaw, or even the back, it's particularly concerning, as this spreading pain is common during heart attacks. Other signs like shortness of breath, especially when it accompanies chest pain, should not be ignored, as it's a red flag for heart or lung issues. Additional symptoms often include sweating, nausea, or lightheadedness. A sudden wave of cold sweat or a feeling of faintness is often the body's response to a lack of oxygen in the blood. If you or someone you know experiences any of these signs, it's critical not to wait and see if the pain goes away. This is not the time for a wait-and-see approach, as a quick response can prevent lasting damage and save lives. Immediate medical care is essential, as chest pain can quickly escalate into a life-threatening event. Call 911 or go directly to the nearest emergency room. Taking steps to prevent chest pain and stay heart healthy is equally important. Regular physical activity can help keep the heart strong, but it's always wise to consult a doctor before beginning a new exercise regimen. Eating a diet rich in heart-healthy foods, like fruits, vegetables, whole grains, and lean proteins, can also reduce the risk of heart disease. Managing stress levels is crucial, as chronic stress impacts heart health. So finding ways to relax, whether through hobbies, meditation, or social activities, can make a difference. It's also important to avoid smoking and excessive alcohol intake, as both increase the risk of heart disease. These lifestyle changes may seem simple, but they are powerful tools for maintaining a healthy heart and reducing the likelihood of serious chest pain episodes. 3. Loss of balance or frequent falls can be a major concern for elderly adults, as staying steady on one's feet is essential to preventing serious injuries like fractures, head trauma, or even long-term disability. Balance is often something we take for granted, but as we age, it becomes increasingly important to pay attention to how steady we feel. Balance issues in older adults can arise from a variety of underlying health conditions, including neurological disorders like Parkinson's disease, inner ear issues, or even vitamin deficiencies that affect muscle function and coordination. Even medication side effects can contribute to dizziness and impaired balance, meaning that sometimes a small adjustment in dosage or treatment can make a big difference. For older adults, addressing any recurring falls or sudden bouts of dizziness is crucial for maintaining independence. If someone finds themselves experiencing balance issues repeatedly, it's worth investigating, as a range of simple interventions could help improve stability and reduce the risk of falls. Something as simple as adjusting a medication, adding a vitamin supplement, or incorporating balance exercises can play a powerful role in keeping older adults safe and mobile. Take Mr. Lee's experience, for example. Mr. Lee, an 80-year-old widower, had always been active and independent, living alone in the family home where he raised his children. Recently, however, he noticed that he'd been feeling a bit unsteady. At first, he shrugged it off as a minor annoyance, thinking it was just part of getting older. But within a few weeks, Mr. Lee had experienced 2 minor falls in his kitchen. Though he wasn't hurt, The incidents left him feeling rattled. When his daughter heard about the falls, she insisted that he go to the doctor for a checkup. During the examination, the doctor discovered that Mr. Lee had low levels of vitamin B12 and vitamin D. Both of these vitamins play an essential role in maintaining balance and coordination, and deficiencies can lead to weakness and instability. Furthermore, the doctor noticed that one of the medications Mr. Lee was taking for blood pressure had dizziness listed as a side effect. With a few small adjustments, adding vitamin supplements to address the deficiencies, and modifying his medication dosage, Mr. Lee's balance improved significantly. This intervention allowed him to regain confidence in his footing, reducing his risk of future falls and enabling him to continue living independently in his beloved home. The improvements also lifted his spirits, as he felt more like himself again, able to go about his daily routine without constant worry. When it comes to balance issues, staying proactive can prevent much more serious problems. Here are a few strategies to support better balance and reduce the risk of falls. First, regular checkups are vital. By having a healthcare provider assess your balance and mobility, they can detect potential issues early and make necessary adjustments to medications or treatments. Second, staying physically active with exercises focused on balance and strength can make a substantial difference. Activities like Tai Chi, yoga, or simple balance exercises strengthen the muscles that help keep you steady. Third, maintain good nutrition by ensuring you're getting enough essential vitamins, especially vitamin D and B12, which support bone strength and muscle function. Lastly, modify your living environment to make it fall safe. Removing tripping hazards, installing handrails, and ensuring good lighting throughout the home can go a long way in preventing accidents. Sudden confusion or noticeable memory issues in older adults can be concerning, as they may indicate underlying health issues that go beyond typical forgetfulness. While mild memory lapses can be a normal part of aging, sudden changes in cognition, disorientation, or consistent forgetfulness are warning signs that shouldn't be ignored. Conditions like dementia and stroke are known to impact mental clarity. But even infections like urinary tract infections, UTIs, can lead to unexpected cognitive changes in elderly adults. These infections may not present with typical symptoms in seniors. Instead, they often appear as confusion or sudden mental decline. For older adults, mental clarity is essential to maintaining independence, and any noticeable shift in cognition warrants immediate medical evaluation to determine the cause and initiate treatment if needed. Let's consider Mrs. Patel's story as a real-life example of how sudden confusion can sometimes be a symptom of an unexpected issue. Mrs. Patel, a friend of mine, 78-year-old former nurse, was known in her family for her sharp mind and quick wit. She was the person everyone turned to for advice, and she never seemed to miss a beat. However, during a recent family dinner, her family noticed something unusual. She seemed distracted, confused, and kept asking the same questions repeatedly. She misplaced her belongings several times during the evening, something that was completely out of character for her. Her family was understandably concerned, so her daughter suggested that they visit the doctor to see if something might be wrong. During the appointment, the doctor ran a few tests, including blood work and imaging. To everyone's surprise, the results showed that Mrs. Patel had a severe urinary tract infection, UTI. This type of infection can often cause sudden confusion in older adults due to how it affects the body's chemistry and immune response. After receiving treatment, Mrs. Patel's mental clarity returned, and she was back to her usual sharp self. Her family learned an important lesson that day about how hidden health issues can affect mental clarity. Sudden behavioral or cognitive changes aren't always a natural part of old age. They can sometimes signal that something deeper is going on in the body. For seniors, recognizing and addressing sudden confusion or memory issues is essential to maintaining both physical and mental well-being. Some key signs to watch for include repeated questions or sudden forgetfulness. If someone starts asking the same questions repeatedly or forgetting recent conversations, it's worth paying attention. Similarly, difficulty with familiar tasks, like managing finances or finding one's way home, can be an indication of cognitive decline. Disorientation or getting lost in places they've known for years may point to a more serious issue. especially when combined with confusion about time, place, or recognizing familiar faces. Another symptom to monitor is sudden mood swings or personality changes, as these can sometimes accompany cognitive shifts. Irritability, anxiety, or even depression can arise unexpectedly and may be linked to changes in brain function. To support cognitive health, it's important to focus on lifestyle choices that engage and nourish the mind. Staying socially active through regular interactions with friends, family, and community can keep the mind engaged and provide emotional support. Engaging in mental stimulation through activities like reading, puzzles, or learning new skills challenges the brain, promoting cognitive function and resilience. Regular physical exercise is another critical factor, as it improves blood flow to the brain, supporting mental sharpness. Finally, eating a balanced diet rich in brain-healthy nutrients, including omega-3 fatty acids and antioxidants, can help protect the brain and potentially reduce the risk of cognitive decline. By combining these habits, seniors can support their mental clarity and independence, enhancing their overall quality of life. Immediate medical attention can be the difference between a manageable condition and a serious health complication, particularly for older adults. Ignoring warning signs or delaying doctor visits can lead to worsening symptoms and diagnoses that could have been managed more effectively if caught early. Regular checkups and open communication with healthcare providers empower elderly adults to address issues before they escalate. It's common for older individuals to hesitate to seek care, often out of fear of being a burden or losing their independence. But in reality, early treatment of health concerns can often prolong their ability to live independently and enhance their quality of life. Proactive steps are essential for healthier aging. Routine health screenings are vital, as they can catch emerging health issues early, reducing the risk of emergency situations. Monitoring medication side effects is another important step, as some drugs may cause dizziness or confusion, symptoms that are sometimes mistakenly attributed to aging itself. Ensuring a safe home environment also plays a key role. Removing tripping hazards, installing handrails, and maintaining good lighting can significantly lower the risk of falls, particularly for those with balance issues. In addition, fostering a supportive social network is invaluable for mental and emotional well-being, helping seniors feel connected and comfortable sharing health concerns before they become more serious. Aging does not have to mean accepting a lower quality of life. By tuning into the body's signals, such as shortness of breath, chest pain, balance issues, or confusion, older adults can take control of their health and enjoy active, fulfilling lives. Addressing these warning signs promptly preserves health, allowing seniors to continue living with autonomy and purpose. Just as in the real-life examples we've discussed, a quick visit to the doctor can prevent a minor issue from turning into a major setback. Ultimately, our health is precious at any age, and taking steps to protect it is both a commitment to oneself and an act of strength. By staying aware of these warning signs, seniors and their families can find a path to maintain independence and peace of mind. With proactive, informed decisions, older adults can continue to live with dignity, strength, and joy. That wraps up our video today. Don't hesitate to share your thoughts and experiences in the comments below. If this video resonated with you or someone you love, please take a moment to like and share it with others who might benefit. Do you have a loved one who struggles with the above? Share this video with them. And remember to hit the like button if you found this video useful. Your support helps us reach more people who can benefit from these insights. And don't forget to subscribe to the Elders Compass. By joining our community, you're not only staying informed, you're supporting a space that truly values and understands the journey of aging with grace and resilience. And let us be your trusted guide through this chapter of life. Thank you for watching, and see you in our next videos.